Good evening. In last fall, we had Brooker and Eckler look at plat language for drainage easements. We had some concerns about it, especially in light of the timber top issue, and we wanted to make sure that we were comfortable with the language. So they did work through November and December. When I got the December bill, it was greater than what I had left on the purchase order. It was too late in the year to increase purchase order, so I need a then and now.
Okay. And you've asked for one reading so that you can pay the bill. Yes, Mr. James?
You might want to remind them what the total bill was that this is an increase from.
So the total.
8840. Legislation.
Yeah, I can't find my legislation right here.
8840.
8840, and I had 5,000 on the purchase order. So.
Gotcha. Okay. $5,000 doesn't take you very far when it's dealing with lawyers.
No.
No offense.
He represents that remark.
Yeah, that's right.
He represents that remark.
Okay.
That's all.
I have Mr. Hall as your second.
That's correct.
Does anybody have any questions regarding 27-21 while we have Denise at the podium? All right. Next one is temporary resolution 28-21. This is for the Service Safety Director to enter into an engineering agreement, and coming again through water pollution control, Mr. James.
This has to do with the cleaning and repair and possible redesign of the concentrate line that runs all the way from the south plant up to the Lawrence Street wastewater treatment plant, and I'll let Ms. Denise Cruz add some more information to that.
So we've been working on a project to clean out that line, and we have to do some reconstruction at both ends to allow us to clean the line. Arcadis has been working on the design, so this is the contract for the construction administration portion of the project, and we're advertising project to bid. We're advertising on February 19th to get the project done this year.
Okay. I'm showing two readings.
That's
and I have
correct.
Mrs. Teener as your second.
Correct.
Any questions for Denise on 28-21? Yes, Mrs. Bobbitt.
What's the diameter of that pipe?
But 16 inches.
16 inches?
16.
Okay, thanks.
I get all the force mains mixed up. They're 14, 16 inches.
Okay, thank you.
Any other questions on 28-21? All right, thank you. Next resolution is 29-21. This is a resolution for the Safety Service Director to enter into an engineering agreement for the U.S. EPA required risk and resilience assessment. Again, coming through water pollution control, Mr. James.
It's my understanding that we're trying to meet some new requirements kind of based on the Flint, Michigan water fiasco, and I'm going to yield some time to Mike Nixon to explain it a little bit better.
Yes, the passing of the 2018 America's Water Infrastructure Act, the U.S. EPA requires that cities complete a risk and resilience assessment for their water systems. I've selected CDM Smith for this work because they have done over 200 of these throughout the country, and they have been working with the city since 2004, and they've put together our current water system vulnerability assessment, our current security master plan, and emergency response plan. This is a project that I apologize for one reading. This is due currently June 30th. It's taken some time with the pandemic to get with consulting firms and for them to get back to me, talking scope and price and starting to work through contract issues. The project understanding, they'll be looking at our pipes, they'll be looking at physical barriers, they'll be looking at our source water, our water collection and intake, pretreatment, storage, distribution facilities, our electronic and computer systems, and any automated systems. They'll be looking at our monitoring practices. They'll be looking at our financial infrastructure, such as billing mechanisms. They'll be looking at our use and storage and handling of chemicals, operation and maintenance, and capital and operational needs for risk management. And then they'll also be conducting risk assessments for all hazards, determine the system's resilience to those hazards, evaluate the capital and operational needs for resilience and risk management, and update the emergency response plan that will be submitted to the US EPA. There'll be several tasks. We'll be getting a lot of people involved in this. The first task is data gathering and review of existing materials. They'll be going through the documents that we have on site. They'll be going through our GIS and our asset management plan. They'll be refreshing their memory on our facilities since they were last here working on items. The next part we'll be getting the fire department, the emergency management people, the mayor, the service director, the auditor, all involved in a stakeholder meeting and development of hazards listings, and that'll take a little time. Some of the hazards analysis will include the following hazards or threats. They'll be looking at malicious acts, natural hazards, accidental, intentional water contamination, vandalism and tampering of storage pumping facilities, distribution system incursions, facility intrusions, employee assaults, threats, pandemic, drone and other physical attacks, and cyber threats. So once they have that all done, we'll be working on the next task, which is the risk and resilience assessment, and we'll be doing consequence analysis, vulnerability assessments, threat likelihood analysis, and then we will create a matrix for each one of those. And then the next task is final report and the risk and resilience certification. And at that point in time, we'll be ready to submit this to the US EPA. We are hoping with the pandemic and the fact that even though the city has been working as though there is no pandemic, we're still doing our job every day. A lot of the other agencies are not. So we're still hoping that the June 30th date gets moved and gives us a little more time, because most of these consulting firms are still having people work from home. You're not as efficient and effective working from home. A lot of them are just now allowing their staff to come into our facilities to meet with us. So we're hoping that the federal government uses a little common sense and gives us a little bit of leeway. If not, we have our schedule set up. Actually, we'll be having, we'd like for this to be passed tonight. We'll have a kickoff meeting the week of February 15th. Then we'll have key site visits that week. We'll be data gathering the month of February. We'll be putting together the data needs list February 26th. We'll be putting together a data collection memorandum the 19th of March. We'll do the initial threat characterization April 2nd. We plan to have a stakeholder meeting the week of April 19th. We'll do a report workshop the week of May 31st. And then we'll do the final report the 25th and submit to US EPA the 30th. So that is our current schedule. It's pretty aggressive, but we'll do what we have to do to meet the deadline.
Yes, Mr. James?
You might want to, we are asking for about $70,000. Are you pretty, feel comfortable that that will cover it?
Yeah, I'm not asking for a new appropriation with this. That the money's already been appropriated. Right. And CDM Smith, who's the consultant that's doing this work, in all their previous projects they've done for us, they have come in within budget. So I do not anticipate, and I was dealing with the principal of the firm on this, and I asked that he really put some effort into his scope so we had it right the first time.
Very good. Thanks for that clarification.
Excuse me, Mr. Hall, just a minute. Mr. Stoughton?
I would assume we would expect some sort of remediation requirements at the end of this process?
I don't know about a remediation requirement. There'll be things the city will have to do and plan for and budget for. I don't know if that's what you mean.
That's what I mean.
Yes,
Yeah.
yes.
I assume since it's our friends at the EPA, it'll be on some sort of schedule?
We don't know the next step yet. We don't know after we submit it on June 30th, how long it'll take them to review it, approve it, comment on it, give us the next set of guidance. It's all an unknown right
Yeah,
now.
but I think we might agree that it's probably gonna cost us some money down the road.
I would agree with that, yes, sir.
Perfect. Thank you.
Okay, Mr. Hall?
Yes, thank you. Mike, do we have any lead mitigation issues that we need to be concerned about at all?
No, lead and copper has been, the city, back when Dave Mornino was superintendent that far long ago, they were dealing with lead services and removing lead services. So the city has been way ahead of the game on lead issues, lead and copper issues. So I don't know that we have very many, if any, lead services left in our city. They were really, really aggressive 20 years ago in starting to get rid of that. So we have worked with Lancaster City Schools and done some analysis of some of the drinking fountains when they had their older buildings, and there were no problems there either. So I don't believe we have any lead issues to deal with.
Thanks, Mike.
Yes.
Mr. Martin, Mrs. Bobbitt had a question. Are you addressing Mr. Hall's question?
I was gonna do a follow-up with him.
Okay.
A fun fact that you don't know, some of people, I thought, Mike, a lot of people don't realize that we do testing out in the field, and I thought maybe you could just talk about the frequency of that, where we see the end product coming out of a faucet.
Yeah, with the lead and copper, we have our lab technicians pretty regularly every year going out and collecting samples in various parts of the distribution system. We're looking for areas that are newer, that have copper services. At that point, we're worried about copper. And then we're looking at the older part of town that might still have some lead services inside their buildings. And that is something that's, every year, we're doing lead and copper sampling and submitting that report to Ohio EPA. And we are feeding a polyphosphate that keeps anything sequestered in the system, so we don't have those issues out in our distribution system. So the city is in really good shape when it comes to the lead and copper. And again, that was something that was set up before me, that they really concentrated on that and been focusing. And we have what we have called coupon sampling out in our system too, so we know the pounds of polyphosphate we're feeding. We know theoretically how much we should feed, but we have samples that are basically pieces of metal out in the system, water running through it, and they're collected every so many months and analyzed and see how much decay of that metal we have, and see if we would need to either change our polyphosphate blend or increase our feed rate. And again, our water's been very stable for many, many years, so we're in pretty good shape.
Okay, Mrs. Bobbitt?
Thank you. This is very, very thorough, or it's going to be very, very thorough.
Yes.
So, you know, sometimes we're made to do things, but after this is finished, the citizens of Lancaster will know, we won't have those naysayers like we used to have maybe 4 or 5 years ago.
Oh, I'm sure you will, the right project.
Well, we might. 70 grand is a lot of money. Is there, did we try to get a grant from the EPA for this? Nah, okay, you can laugh at me. All right.
No, I love when they come up with these ideas. It's much like the asset management program. They claim that these are supposed to be relatively simple programs that are put together that people should be able to do in-house, and I don't know too many utilities that have the time or the resources or the expertise.
That's a lot to,
handle
I mean,
these
yeah, this
in-house.
is.
So, yes, it is a fair amount of money, but again, because CDM Smith has done the past vulnerability and assessment study, they've done a security master plan, they're way out ahead of the curve in knowing our system. They just have to come in. They haven't been here since '07, so they have to come in and take a quick tour. Not that much has changed, to see what else changed, and then they'll be able to be up to speed. They've already got everything they developed for us. They've had it pulled up on their servers. They're already familiar with what they did in the past. So this will be aggressive. This will be interesting. It will open our eyes, I'm sure, to some threats and some vulnerabilities that we have, and it'll give us some tools in which to address them.
Thank you.
Great. So I have one reading. I have Mr. Hall as your second.
That's correct.
And are there any other questions before we move on to the next resolution? Okay, great, thank you. Temporary resolution 30-21 is coming through service. This is a resolution due to an expected retirement in the sanitation department. Mrs. Teener.
Well, Bill has this funny feeling he thinks he can retire. I don't know what that's all about, but, and Molly is, well,
I'm gonna let Molly speak on this.
I'm Molly Asbell. I'm the secretary at the sanitation department. So while we had put money in the retirement account, anticipating a retirement, we did not expect it so soon. So as of the end of February, Bill will be retiring, and we are about $3,000 short of covering that final check for him. So we are requesting to take funds from the unencumbered balance and increase the fund, or the amount in the retirement account. I am asking for one reading due to the short time frame that we're looking at between now and that date.
Okay, and I have Mr. Matlin as your second. Are there any other questions?
Just a comment.
Yes, Mr. Stoughton.
Congratulations, Bill.
Yes, Mrs. Bobbitt?
Congratulations, but I don't know if it's a good opportunity right now or maybe later when we have updates. I'd like, you shared a lot with us in the service meeting. I'd like for you to share with everyone and the citizens our contract that was passed. So if you want to do that now or later.
Well,
How about later, please?
Later.
Okay.
Thank you.
All right. Are there any other resolutions to come before finance? All right, moving on to ordinances. We have temporary ordinance 6-21. This is an ordinance that will update the Lancaster codified ordinance by repealing portions that are no longer applicable. It is coming through finance because it deals with the contributions to the disability and pension fund. Mr. Stoughton, I have you as my second.
Okay.
And we're gonna go 2 readings. Does anybody have any questions on this ordinance? Yes. Oh, I'm sorry, Mr. McDaniel, I
No,
thought you were raising your finger.
I think they're just outdated and need repealed.
Yep,
Right.
it's a cleanup. Okay. Moving on to temporary ordinance 7-21. Again, this is a cleanup piece. It's the ordinance to update section 131.01, which is outdated due to the police department's current public records policy, and 131.02 and 131.03, which are negotiated benefits that are no longer offered, which is why it's coming through finance. Mrs. Bobbitt, I have you as my second, and we're gonna go 2 readings on this as well. Okay. Other discussion items. Do we have any departmental updates this evening?
well, a couple things that we discussed in our committee meeting. Starting January 1st of this year, instead of paying $35 a ton, Molly and I worked on a contract all last year, got it all worked out. We're now paying $27.50 a ton for disposal of trash instead of $35. You have a 7-year guarantee that this price will not go over $30 for the next 7 years. And then there's a 1+1 added on at the end if they want to keep the price low. I called around, Molly called around, we got a lot of outside trash haulers bidding. We'd like to keep it in our solid waste district, but we're not required to by law. So I had talked to bidders from as far as Canton that was interested in it, and it made our current hauler sharpen his pencil when he came in with a price that just blew us all away. So we're saving about $7.49 per ton, which when you're talking 32,000 tons a year, that's a lot of money. Paul and I have just finished going over the ordinance. The next council meeting, I'll have more things. I want to change 3 things in the ordinance. One of them is to raise the minimum at the transfer station to $25. That would still make us about $30 cheaper than anybody else. With the oncoming of things that's coming, people wanting us to take credit cards and stuff, that's how we think we can pay for it. The other thing I'll be bringing in, which will probably be my last council meeting, is our yearly truck deal. We need a new front load truck. Paul and I kind of hashed it out this morning, thought we had it done, and then I got third for a curve here about 5 o'clock this evening. And it could be, after Paul and I discuss it, it could be the way to go. So, next council meeting, I'll have several things to put on the agenda.
Great. Thank you.
You're welcome.
Are there any other departmental updates?
Good evening. Few updates from the engineering department. I just want to give everyone a heads up on various projects that are going to be coming forward here. We just had some contracts signed with Shelley Company on our 2 projects, the Fair Avenue project and the 2021 street improvement project. So I know it's February and it's cold and we're getting snow tonight and those types of things, but you know, it's not going to be long when the concrete work will be starting on these types of projects. It'll be into March, beginning of April, which is not that far away. Orange barrel season's, you know, getting closer. And also, just an update, we're going out for bid for the Edie Road project here come February 25th. So we're looking forward to that project getting kicked off and moving on that. One thing that has come up here just recently, we just got our bids back for the Safe Routes to School project, which is the sidewalk project that's going to be coming from the Medill Elementary School down to Frederick Street. So we have some weird things that we're going to be dealing with ODOT on that. We're actually Safe Routes to School is 100% funded by, they fund everything in terms of design, construction, the whole 9 yards. We were granted $373,493. So we're, based on some of the numbers that we've all pulled together over the time that we've been working on this project, we're like $343 over, which is not a big deal. I can use some of my budget that I have in some of my engineering consulting line item budget to cover that. It doesn't have anything in my budget to cover like change orders, and we won't know those numbers, and we don't even know if there will be change orders that will happen for that because it's all based on unit prices and whether we non-perform certain things or perform extra of certain things. But we always have a contingency of change order dollars, and we don't have that with this because it's 100% paid for by the feds. So down the road, if that were to come, that's something that, you know, I'll have to work with the administration and we'll have to come back to try to find where we would come up with certain types of change orders that might come through the project, because we typically just don't have dollars sitting for sidewalk projects. So,
Yeah, Tom.
Quick question. So what would you expect on a project like that we should account for change orders?
I like to account for 10%.
We're talking, you know, 35 grand-ish or 40 grand?
Yeah.
So, I mean, if we had to pick that up through capital improvement, the project is more than worthwhile to do that, so.
Yeah,
I
that's,
mean, in the absence of you having budget for it, I mean, I think that's an appropriate use.
yeah.
So,
Th-
that
I think
helps.
that's the discussion that we would have to have at the time, if it came to that point,
Sure.
but yeah.
Well, no, but I don't want you to stress over the fact you need to find money.
Yeah, okay,
I mean,
thank
that's a
you.
good, that project is obviously
Yeah.
a good project we need to do.
Yep, yep.
Okay.
So that should be getting started here as soon as the weather breaks as well. The contractor is Newcomers Concrete. They're the ones that were the apparent low bidder and the one that ODOT is planning to contract with. So little update on a few projects that are forthcoming here.
Yes, Mrs. Bobbitt.
Where are they from, newcomer?
Oh,
Not in this county.
That's okay. That's okay.
I thought it was the northeastern part of the state. I don't really know.
That's okay.
Yeah,
That's why we have Google.
yeah, right. They're pre-qualified through ODOT.
Right,
So they have
right.
to be able to bid.
Right? Mm-hmm.
Yes, Mr. James.
Just one other quick question. Are we going to have to supply our own personnel to help monitor this program, or do they have other people that'll do that?
No, so as part of that number, that 373, the original grant, so ODOT, through that bidding process, they provide construction engineering, which is the inspection and stuff, and that's all part of that dollar figure where we're $343 short for that. So it's all within that dollar amount, so.
Okay, any other questions for Mitch? Thank you, Mitch. Are there any other departmental updates? Yes, Mr. Martin.
So I know Chief Ward's back there in the corner, but, you know, we're moving forward with hiring. We made some contingent offers last week, probably the most I've ever done in 1 week. So contingent in the fact that they still have to pass some critical stuff, but look very promising. Just grateful for, again, the income tax levy passing so we can fulfill our promise that we made to the community to restore some of the people back into our fire department. We're also still working and moving through the list. We just, for our police department as well, we just had 2 tests for police and fire. Last Friday night was fire, the week before, so we got some current lists we're gonna be working off of. It's quite a process, takes several months, but I just wanna let you know, we're moving forward, trying to get those positions filled with the best qualified people we can.
Thank you. Okay, any other departmental updates? Seeing none, I will turn the floor over to President Uhl for tonight's meeting from.
Thank you, Madam Chairwoman. We have a couple of ordinances coming through code enforcement and zoning tonight dealing with our code enforcement ordinances, and so I'll turn it over to Mr. Matlin to talk about temporary ordinance 4-21.
So I'm a little bit out of the loop because I didn't realize these were coming to tonight. We had talked about these at the code enforcement and building meetings last year, but they were not ready yet. So what I read in the community reinvestment area that was passed in June of 19 to try to spur residential building in those areas, this changes the zoning to allow, the first one, 421, changes the zoning to allow triplexes on certain lots as well as duplexes. So if a person, a builder wanted to utilize the property tax, the CRA3 benefits, they could put a triplex in. Also allows 3-story buildings. The second one, 521, deals with container homes, and it changes the zoning to allow those container homes in the same certain areas, but does not change the building code. So you still have to follow Ohio building code and regulations. So hopefully by the time we have the public hearings, I'll have more information and I'll be more aware. I feel a little bit stupid tonight because I was not aware.
Feeling out of the loop, you did just fine there, explaining both of those resolutions, so thank you for that. I don't know if the administration wants to add anything else, given that these came forward.
So we had our our planning commission last week, and they were all pushed forward unanimously. That's a group of 5 citizens as well as the mayor and I. The first one is really just taking some very small lots, pushing those 2-3 lots together and try to get a little bit more marketable housing, so to keep it from having, you know, a triplex instead of maybe 2 duplexes. So it's really taking that width of 2-3 lots and only putting 3 units in instead of 4 possibly. So, you know, we support it as a city. The second one is a little bit different than we've ever had here in the city, as you said, Mr. Matlin. One thing good about this ordinance is you look at container homes, there's a craze across the country. You can look at those in your website and find out all kinds of them. But this ordinance is not gonna allow those to be put into currently residential areas. This is going to be allow those in some light industrial type of areas. And more explanations, we'll probably do some more official presentations on that, especially as President Ewell, you have the privilege of having a public hearing here in regards to maybe some of that.
Yeah, I'll note there's a public hearing for ordinance 421 on February 22nd at 6:30 and a public hearing set for March 8th on 5/21. So anyone have any questions? I don't know where these came out of, but just as a note, probably not the best thing for the chairman of the committee to not know that they're coming forward in the future. So if we can be sure we're looping folks in as things are coming forward, I think that would be helpful. Ms. Bobbitt?
So if I wanted to, once again, Google these container homes, well, what's the best place? I have Googled container homes, so we're not talking about a certain company right now, we're just talking, let's just get the ordinance changed to get it happening, to get it started.
Yeah, I'm not exactly sure what, the first one came really from, our Port Authority Economic Development, trying to, as we're concerned about our workforce, to try to get an opportunity for more residential areas for people to live in. But the container homes, they're really all over the board. I will tell you this, that the state of Ohio only authorizes 3 specific containers that are manufactured, and they're really not in our country. They're manufactured outside of our country. So there's a lot that the state of Ohio Building and Regulations is working on to make sure those approved containers are able to use and meet their code. It's going to be a very strict building code applied to those, from plumbing to electric to everything else. So I'm not really sure at this time. We can go more into the details when we get through that ordinance. But you can see some very elaborate stacking, 3-stack. We're not really probably talking about those. They're probably going to be smaller, but light industrial. We actually have a company here in town that manufactures right now containers dealing with international mobile medical units that are sent around the world. Maybe there's a desire from them, and I know Mayor might know some more about that, but we wanted to take it is a movement across the state of Ohio and across our country, and we thought if we could give some direction of where they can go and where they can't go. Because some of us would be concerned that you just can't take this stick house, wooden house, and then all of a sudden you got a available lot, and then you got like a container home there. Even though some of them can look pretty nice, they're pretty elaborate on the web, but you can also see some pretty ones that you would not want to have next to your house as well.
Right, this is a great step, but, just you saying that right now Ohio only has 3 approved.
They only authorize 3 approved containers manufactured in another company. They're not really made in America. So that's the core, that's the container, but they're built out here per our building standards. So they're not really gonna be made. It's gonna come as an empty container. It's actually gonna be used to be shipped across the ocean. And you bring in product.
Mr. Mayor.
So, these containers that you see them all over the place, they're basically used one time to ship something from overseas here. And the state of Ohio only permits container modular home or office manufacturers to use the containers manufactured by 3 foreign companies because of the materials they use. It's a environmental safety type thing. So it's not 3 container homes, it's 3 manufacturers.
3
that make them.
manufacturers.
Right, so because their materials are better that are put together. This came, both of these ordinances came from economic development. We have gotten over the years requests from many people to do what they call tiny homes, and you've probably seen those in the movies and such. And they don't really fit in the residential neighborhood zoning areas. With the container homes, they can be more controlled. They're standard size. They're not, 8 by 8 or something like some of these. tiny homes that you see around or that we've requested to approve in residential areas. So this allows these container homes only in industrial light zoning areas, which there are some around the city. So they're not going to be in neighborhoods next to a house or anything. And
Thank
again,
you.
we'll have more information when the public hearing comes up.
Yeah, we have plenty of time to work through this with 3 readings and a public hearing. So, Ms. Teener.
Kept hearing overseas, three different places. Where are the countries that are, could you,
I believe they're almost all manufactured in China.
well, that's
So-
what I thought.
And they're basically used to ship products manufactured in China over here, and then they're not used anymore because we don't ship a lot of stuff from here to China, so they don't want to take them back over there empty. So they're single-use things, and once they hit over here, they have to do something with them. There are some pretty unique uses. Max Container here in town has a contract to build mobile hospital units for another company that I believe the initial contract, all the units will go to Indonesia, is my understanding. So it's quite a big deal.
Upcycling.
Upcycling. Reuse, recycle, reuse, and restore, or something like that.
Very good. Further questions? Okay, so Mr. Matlin, we have Mr. Schoonover as the second on 421 and Mr. Hall as the second on 521. Again, these both going for 3 readings and a public hearing set for the 22nd on the 1st and the 8th on the 2nd. Any other questions? Very good. With that, I believe our meeting prep is finished. I'll turn it back to the chairwoman.
Thank you, President Wood. Are there any other items for finance? Seeing none, I'll entertain a motion to adjourn.
I make a motion, we adjourn?
Second.
Meeting adjourned at 6:37.
The regular meeting of Lancaster City Council will begin at 6:45.
Dagger Law has been part of the Lancaster community for more than 110 years. This is where we live and work. You'll see us at festivals, sporting events, and all around town. We consider our clients as friends, and we walk alongside you through challenging times. Whether you're a growing business, a changing family, facing litigation, planning your future, or dealing with land issues, we're right here. We are local. We are trusted. We are experienced. Dagger Law.
There is no place like Lancaster, Ohio, and Fairfield County, and like you, I am proud to call them home. As a longtime resident of Lancaster and graduate of Lancaster High School, this community is important to me, and I want to provide superior customer service, professionalism, integrity, and honesty at the Connor Insurance Agency. I am committed to supporting local programs and projects through my volunteer work and board membership with several organizations. It has been a great honor to work with all the first responders throughout Lancaster, Fairfield County, and the state of Ohio to put on Kids and Cops Day, to be a part of Shop with a Cop alongside the Lancaster Police Department and JFS, and to help Lancaster Public Education Foundation raise funds to support our local public schools and teachers. These men and women work hard to protect and support our community, and I would like to take this moment to say thank you for all they do. My goal as a business owner and insurance agent is to provide my clients with the most appropriate services and coverage for their needs at a competitive rate. As an independent agent, I have several carriers to choose from so I can customize your insurance coverage to fit your needs and desires. I strive to make sure there are no gaps in your coverage that could be harmful, and just as important, that you are not overinsured. I look forward to serving your insurance needs now and in the future. At Connor Insurance, we are here to serve you by protecting what is important to you. Please contact my office at 740-654-2848 for a full list of services and carriers, or visit my website, ConnorInsuranceAgency.com.
Swing into the Carriage Company and check out our sweet deals.
If you're looking for the best selection of clean, quality used vehicles, look no further than the Carriage Company. You'll feel secure with your purchase, knowing all vehicles undergo an extensive safety and service check prior to the sale. And all vehicles can be viewed online at carriagecompany.com. The Carriage Company, located at 1031 North Memorial Drive in Lancaster.
So wait! The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Please join me in a word of prayer. Father, we are thankful for this day and your blessings, thankful for once again to be gathered here together to go about the work of the city. We pray that you would continue to be with us, lead, guide, and direct us tonight in the work that is set before us. As we have been over the past many months, we continue to pray for those in the military, our first responders, those who are on the front lines of helping during the pandemic, and anyone else who may be placed in harm's way this day. May you protect them and keep them, we pray. We ask all these things in your Son's precious name. Amen. I hereby call this meeting of Lancaster City Council to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All members of council and administration, please remember to have your microphones on and to speak directly into them so those who are watching can hear this evening. Please call the roll.
Mrs. Bobbitt? Here. Mrs. Downhour?
Here.
Mr. Hall?
Here.
Mr. James?
Here.
Mr. Matlin?
Here.
Mr. McDaniel?
Here.
Mr. Schoonover?
Here.
Mr. Stoughton?
Here.
And Mrs. Teener?
Here.
Let the record reflect that all 9 members of Lancaster City Council are in attendance this evening. Reading and disposing of the journal.
I'd like to present the regular meeting minutes dated January 25th, 2021.
Mr. President, I'd like to make a motion to receive and file the journal.
Second?
We have a motion and a second to receive and file the journal. Any discussion? All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries. Reports of city officials.
Email dated February 4th, 2021 regarding service committee agenda submitted by Mrs. Teener, and an email dated February 8th, 2021 regarding finance committee agenda submitted by Mrs. Downhour.
Mr. President, I'd like to make a motion to receive and file the reports of city officials.
Second?
We have a motion and a second to receive and file reports of city officials. All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries. Are there any communications?
There are 2. Notice to the legislative authority of a transfer liquor license from Deborah Reynolds, doing business as Hillbilly Heaven, located at Front Portion Building and Patio Only, 321 South Columbus Street, Lancaster, Ohio, to the Mithoff Companies Ltd., Front Portion Building and Patio Only, located at 321 South Columbus Street, Lancaster, Ohio, submitted by the Ohio Division of Liquor Control, and a notice to the legislative authority of a new liquor license to Buckeye Nail Spa, LLC, doing business as Buckeye Nail Spa, located at 1405 Edie Road, Lancaster, Ohio, submitted by the Ohio Division of Liquor Control.
Find out some interesting things as
Well, when they do have
work
these
through
spa
these.
things, then they have a little bit of drink with it.
Apparently so. Ms. Teener, are you speaking from experience?
No, I drink at home.
Okay, very good.
I'm safe.
Mr. Schoonover.
Mr. President, I'd like to make a motion to receive and file the communications.
Second?
We have a motion and a second to receive and file communications. All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries. Tonight, you'll note on the agenda that we have a special presentation. I'd like to say that this was, on my part, well planned out and thought through, and in fact, it was an epiphany that I had this morning where I thought it sure would be great if we could invite the CEO of Fairfield Medical Center, Jack Genoso, to come and provide an update on the coronavirus pandemic and what's happening here in Lancaster. And as I texted him mid-morning and said, hey, are you available this evening, I fully expected him to say, oh, you know, maybe next time can we do it, just because of how busy he is, and nevertheless, he is here tonight, along with the Chief Nursing Officer, Mark Vanderhoff, as well. And so we want to invite you 2 gentlemen to come at this time, and want to say thank you for coming on such short notice to provide us an update on what's happening here in the community. Thank you for being here.
I feel naked without my mask. I apologize. Hasn't happened much in the last year. I'm Jack Genoso, President and CEO of Fairfield Medical Center, and this is Dr. Mark Vanderhoff. Mark's our Chief Nursing Officer and has been relatively the architect of a lot of what's happened at Fairfield Medical Center through the bulk of our pandemic. First and foremost, to give you a very brief update, obviously it's been a tough year for all of you, all your businesses, our community, and Fairfield Medical Center has been very blessed by the support we've had from all of you. So I want to thank you very emphatically from the bottom of my heart, not just for the moral support, the cards, the letters, the thank yous, the drive-ups, everything you've done for us, but also through your acts of standing up to take tough stands on issues that have made a huge difference for us. To give you an idea, we didn't have a ton of time to present any formal materials, but I want to show a graph. I'll hold it up so you can see, and it's pretty self-explanatory. This graph, what this shows is what's happening in our region. We're in a region of healthcare providers, which includes Columbus. But what this generally shows you is the trends of COVID hospitalizations as compared to the norms. And you can see that we've been through 3 distinct humps in this curve. The last one, obviously, by far the most severe. That started right around the beginning of November. It escalated up through the middle of December, and you can see we're coming down to a nice trough now. The problem is we've seen this a few times before. So, not to this significance, but we have seen this hump and this draw, and every time we do as a healthcare provider, as all of our colleagues do, we tend to get optimistic, only until you start to see it go the opposite way again. That's up until this past month or two when we've now had access to vaccines. So we finally have an offensive weapon. We'll talk a little bit about where Fairfield Medical Center is with vaccinations and what we're doing to help our community. But just to give you an idea, just since the pandemic started and back in late March, early April, Fairfield Medical Center alone has tested over 31,000 people, almost 32,000 people for COVID testing. Of that, we've had close to 4,200 positives. That's equating to about a 13% positivity rate in total, but what you have to recall is that up until probably November 1st, that rate was running about 6%. Beyond November 1st to current date, that number on some days was 40, 50, 55%, which has bumped that total rate of positives to tests up to almost 13%. So you can see in a relatively short period of time, the acuity that's hit our community has been very large. The last time I saw many of you was to make a public appeal to really focus on social distancing, the usage of masks, the hand washing, social distancing. And I know it's tough to do when you're also responsible for the economy, helping businesses thrive, helping families stay together. On the opposite side, we saw this influx of very, very sick patients, unlike we've ever seen before with one acute illness. Our critical care teams at Fairfield Medical Center have worked tirelessly. But what I will tell you, and I'll emphatically say this every time I'm asked, we've learned a lot through this pandemic. We've learned through our own failures and our own successes. Things we thought we knew back in April are almost laughable now. The initial modeling data we saw had the pandemic gone by July of 2020. So we've all learned through this process. So as this rolled out, we established policies that made sense in the moment. Looking back on them over time, we've seen that those policies needed to change. What I could tell you is that Mark, his clinical team, we have a COVID committee which includes Dr. Andy Murray, it's included Dr. Renee Wagner, many hands in the organization, clinical and otherwise, to help figure out what to do on any given moment's notice. There's no pandemic playbook, at least there wasn't up until now. So we've had to learn as we go, and we've also learned from the region. Being part of that region, being part of the state, has really helped us manage the volumes that we've seen. And what we've seen is that it's happened in different waves. What could happen in Columbus might hit us 2 weeks later. What might happen there might not happen to us at all. But what we saw in November and December and January was that it happened to every one of us all at the same time. So that's why you've constantly heard about critical care beds being tight, because there were none. For instance, we could see a level of care at Fairfield Medical Center that's very high for a community our size. But when someone needs care and we need to send them somewhere, when there's nowhere to send them, that's alarming. We never got to a point where we couldn't meet our needs, but we came precariously close numerous times, and we had to reinvent the organization literally on the fly to make this work. So I'm very happy to tell you that the trend is moving in the right direction. We're seeing fewer critical care patients than we've seen in the last 2 months. That number's going down. It feels very manageable as today versus what it did a month ago. But again, what we've learned in this pandemic 3 times now is that that could change with the wrong things happening in the community. We need to encourage people to get vaccinated if they can get it, and we'll talk about that in a second. The second issue is that we need them to maintain the defensive posture of wearing their masks, social distancing, washing their hands, doing the right things. One bad outcome can create a lot of sickness, and we've learned that the hard way. And I think when it hits closer to home, people pay attention to it more. Unfortunately, we have lost members of our community, loved members of our community who will not have their loved ones any longer, and it is very real. Fortunately, not everyone gets that sick, and with vaccinations, hopefully that will continue to abate. But we also are desperately anxious to get back to normal. Some things that have changed for us that are very not abnormal for us as an industry are emergency room volumes. Traditional emergency room volumes are down almost 50% from where they were a year ago. That's not unique to Fairfield, that's across the nation. That is our front door. So if it wasn't for these COVID patients, we would be having a lot of strife right now with just sheer volumes. So we're managing all aspects of this. I'm very proud to say that through this pandemic, we've never laid off one person. Many organizations laid off thousands. We did not do that because I need these people to care for folks when they present to us. We did offer voluntary furloughs when the pandemic started because there was a period of time where there was nobody in our parking lot, no one. When we were all sheltered at home, it was like a ghost town. It was very unnerving for folks like ourselves who are used to seeing a fairly vibrant business. But we also knew the pendulum was going to swing eventually, and it did. And it hit us hard in November and December. But I'm very proud of our organization. They've stood up very, very well. As far as vaccinations go, we are in the same boat that you're hearing on the news. There is a demand for it. The demand is far greater than the supply. To date, we've received about 1,200 vaccine doses for 1A population, our frontline caregivers, and those have all been allocated. To date, we've received about 300 doses for the community, and we attempted to work through the Fairfield County Department of Health on that, but what we quickly found was that they have a big enough task, so we decided to use our new community center for the purpose in which it was built. So we've taken the doses we've had, we were able to reach out to the populations that were eligible, and we were able to get those vaccines to those folks. We maybe have another 100 that we know are coming next week, and then we're going to we're going to be offering vaccinations for all the school districts in Fairfield County. That's going to be 4,000 to 5,000. So we are now very practiced in vaccine distribution, and that's the business we're moving into next. So, you know, we need all the support to ensure that we can get that done well. But what I also want to assure all of you is that what is not happening at Fairfield Medical Center in our community is we're not seeing people cut the line. We're not seeing people use political influence or social influence to get ahead of the line. We won't let that happen. I assure you that that's not part of what we will let happen ethically. In the organization, we are following the governor's guidelines to a T. And we have a committee of people that are managing this, including our chief pharmacist, Patrick Hellman, who has done an outstanding job of being the point person for vaccine distribution. We're going to be tested in terms of volumes. We're already scaling up our plan so that we can move from hundreds to thousands. And we anticipate that that's going to go on for the bulk of the spring and summer. And we'll continue to offer vaccines as long as we have them. But we really typically don't know when we're getting them until a few days prior to getting them, maybe a week at the most. And that's just the way the process is going to work until the supply chain catches up to the demand, and that's fine. We're ready to go. We've tried to create a more empathetic solution for people instead of having to fish a website and hope like you're clicking on a seat assignment at Southwest Airlines. We're making it a little bit more personal. We're calling people, inviting them to their appointments. They're showing up on time. They're getting their vaccines, and they're getting their follow-ups scheduled at that same point. So we're trying to make sure that we do this the right way. But I've covered a lot very quickly. One of the things that I am going to talk about very, very briefly, and I'll let maybe Mark add some detail to, is that one of the criticisms we have taken is with our safety policies. I've had a lot of community complaints about visitation restrictions, and even with folks that have been COVID compromised, even to the point of expiration, their families are upset that they can't be with their families. You have to understand that with a limited number of people, our objective always is to be safe first. Keep our staff safe, our employees safe, our community safe. And over time, we've learned that we could probably be a little bit less restrictive when it comes particularly to folks who are passing to let their loved ones be with them. So we recently have made a change in that policy, and we've migrated it very carefully and slowly because unfortunately, with the limited amount of resources we've had to really take safety to the utmost. But Mark, I don't know if there's anything you'd like to add in that regard.
So good evening. Really a privilege to be here tonight. I just want to add, and Jack really set this up very nicely, the experience that we've had through COVID has been one of uncertainty. So it started with how do we get enough testing supplies to make sure that we can understand the status of patients when they come in. It then led to how do we make sure we have sufficient bed placement, staffing to care for those patients, and then the constant change in terms of recommendations and how you operate safely in a clinical environment in providing care. So that PPE, the personal protection equipment, and so on. Jack also mentioned that, you know, decisions that we made in the past, you go fast forward a month, it feels like, my goodness, we've changed so much because our understanding changed. And one of the things that we realized as well is we had a very healthy concern about visitation. when we're dealing with death and dying, to keep the environment safe, because all these patients are in a negative pressure room that is intentionally sealed off, the door is closed. We enter that room with heightened protection, and understanding how in that critical moment to have family members visit a dying loved one was heartbreaking. And it is balance, it's finding that balance. We've evolved from having the patient's loved ones being outside the door and speaking to them, to today is we have 2 family members who actually go into the room, and we don them with a personal protective equipment, and give them a half hour to be with that family loved one as they're approaching that time of death. And it may sound, I don't know, look, we didn't cover a lot of ground, but I cannot express fully the distance that we covered to get to that point. To bring family into a COVID unit, into an isolated room, that we feel with a clear conscience that they're safe, that our staff is safe, and we all had an abiding focus to make sure that that person has family and don't die alone. And it was heartbreaking to see that into balance, and we were very clear asking the community regionally with other hospitals and health systems, how are they doing it? And I think what we have demonstrated is we have taken lead in terms of doing things that may be a little different from the region, and we can control that, and found that the value of having the family with a loved one at the time of death and dying was not only the best gift we could give that person, but our staff alike, because they were carrying this burden of seeing that no one would let another person die alone. So very privileged to be part of an organization that has thought progressively, but also recognized that in our world it seemed like things are changing rapidly, but from outside appearances it may seem like that cadence was slower. But I can tell you, and I'll just stop here, that the pace at which we go at, really what we always keep first and foremost in our focus is safety, and making sure it's a safe environment, because that's really where things go right, is if you abide to the highest dedication to focus on the safe care of the patient, our associates, and those family members that enter our organization. Thank you.
Great, thank you. Gentlemen, thanks for being here. We have a few minutes for questions.
Absolutely.
Great. Yes, Mr. Hall.
Yes, 2 comments and then a quick question. From the standpoint of comments, over the span of the duration of the pandemic, the ratio of deaths to infections has dropped dramatically. It's 1/10 of what it was at the beginning of the pandemic. And then the second point, the ratio of death to hospitalizations in terms of looking at our community to the state average, which is sort of a proxy measure for how effective our healthcare system is at responding. The last time I looked, we had a better than state average ratio of deaths to hospitalizations, which I think is a testimony to the work that Fairfield Medical Center is doing in our community.
Thank you.
But the third piece, Ohio University is in the process of doing an analysis of a statistically significant sample of Ohio adults, looking at resistance to vaccination. And even though there is high demand in the southeastern part of the state, we have an elevated number of adults that are indicating that they're not going to accept the vaccine. And I was wondering if you have thought through some messages or what kind of things that we need to do as public officials to help people understand how serious this problem is and what we might need to do to help move public opinion in the right direction.
It's a really good point, and I think that, because the supply has been short of the demand at this point in time, and there will be a point in time where it catches up, but what I could tell you is that we've taken some of the most important people in my mind right now, which are your physicians, your critical care nurses, your support people, the folks that are keeping people generally healthy in your community, and all of our 1,200 vaccines were distributed. All of our employees are back at work. We had very few, if any, allergic reactions. So we have evidence to show that the vaccine isn't making people ill, it's not ill-contrived. And hopefully over time we can show that it's effectively keeping people from landing in our intensive care unit. But to your earlier point, it's also really a great testament to the fact that this community is blessed with some of the best critical care people I've ever worked with in my entire career. I mean, these are physicians who have been participating in all the research studies that have been going on at the Mayo Clinic across the country. We volunteered to do things to learn because I think, as Mark and I are trying to tell you, we've had to learn the hard way. We've had to learn through trial and error. We've had to learn through mistake. And what we've quickly tried to do, and we try to create this blame-free environment where we learn from our failures to try to create success, is that we found that what we thought we knew back in April was almost laughable. We often kid ourselves about how many times our plans have changed, and if you went back and tried to chronicle them, we'd be like, what were we thinking? But it's all been based upon relevant knowledge, knowing what this disease does, how to treat it better, how to keep people from dying. The things we've learned is amazing, but we've had to learn it in a vacuum, and we've had to learn it under a microscope. And so, to your point, I think the vaccine falls into the same category. I think people have a right to be skeptical, so we've not made it mandatory, but we have encouraged people that if you're really on the fence, opt for taking it, because we have emphatic proof standing next to you by your colleagues that it's not going to kill you, and it may just save you. And I think right now that's all we have to go on. And that's really the biggest message we can have, is that we finally have an offensive tool. Let's use it.
Great, thank you. Others? Yes, Ms. Bobbitt.
Thank you for being here tonight. This is very informative, and I know the viewing public, I'm sure that they're appreciating you being here also. My question is, I got a text from somebody earlier that says, I'm coming down to one of your, I won't mention the store, I'm coming down to one of your stores tomorrow to get my vaccine. Well, she lives near Powell, Ohio. So in regards to the vaccines, how is that working? Are certain stores, maybe if somebody in Powell, Ohio signs up to get a vaccine at, well, no, I'm not going to say a store. So how does that happen? How does she, she's coming here tomorrow to get her vaccine.
Well, I think your question ties very much to the rate of adoption. Right now, particularly, I can only speak from a hospital's perspective. I can't speak to retail. I'm not really certain what their process is or isn't
Okay,
different than
that's
ours.
fair enough.
Hey, Jack, come up to the mic
I'm
a little
sorry.
bit better.
I can't really speak to what a retail store's experience has been different than us, but for us, we have a website where people could register who are interested, and if they fit within the age criteria, they can register, and we pretty much take it on a first-come, first-served basis. We do validate their age, we validate, but if you substratify this down anymore, by the time we find the people to do it, we're so far behind in vaccinations that the problem won't catch itself up. So I think right now, most providers are trying to find people that fit within the eligibility that are willing to take the vaccine, and they're giving it to them. Every less Ohioan's a less Ohio. So I think we're trying to stay ahead of the problem, because what we're concerned about is what happens when we go from 200 to 300 a week to 2,000 to 5,000 to 10,000. We'll never be able to do that ourselves. So I think we're all learning how to be more efficient at this. Even in the few clinics we've run, we've become way more efficient. We know we could do more. We've wanted to build some deliberateness into this to make sure we do it right, keep people safe. But right now, I think people are trying to reach out anywhere and everywhere they can to get on a list, and then some people are getting called. It's almost like winning the lottery for some folks. We're trying to make that more deliberate to our community, but it's virtually impossible to not have people who've gotten to your website, got on your list, and we're calling them, and if they can be here on time and show up and get it, we're giving it to them.
Fair enough. Thank you.
Others? Yes.
Earlier you had quoted some statistics on testing and positive results. When you're mining that data, are you taking into consideration individuals who have had numerous tests for preoperative testing, repeated tests? Because just personally, I know somebody that's had 7 COVID tests, and I find it very ironic that I just doubt that that's being taken into consideration.
Well,
so I wanted to ask that.
And I will tell you that I think when people are searching for knowledge, all these indicators mean something. It's a baseline for us. It just shows what we've been looking for through this entire issue. First and foremost, to Mark's point earlier, just getting access to ample testing facility is taken us almost 8 months to do. We now have enough testing capability within the organization where we don't have to rely on outside sources for testing outcomes. But to your point, the numbers themselves don't tell the complete story. What we're looking for is the rate of infection and the rate of illness in our community, and that's just one indicator. There's many others that we look at that help validate that number. it's just an easy one for people to understand, that the rate of demand for testing and the positivity to the number of tests being taken has risen substantially in a very short period of time. That's how we knew a few months ago that what you were hearing and seeing on TV about this post-holiday surge, and actually the surge started before that. It probably started right around October. But what you have to, when we're dealing with patients every day and people coming into the emergency room with symptoms that you can't immediately validate, you have to assume that they're sick. That means they consume a critical care, they might consume resources. So really this is about more resource management than us than arguing the validity of statistics. It's really a baseline that we look at. But what I will tell you is that we have seen, as I showed you earlier, we're seeing that number come down. We just want to see it stay down and go away. And I think that when people get lax, things start to fall off. And what we're asking right now is even more diligence. We're moving in a great direction. We just don't want to see another surge. We really don't. I can't begin to tell you the amount of anguish that I see on the looks of my people's faces every time we think we're getting better and then it gets worse again. And after 3 times, I think the fourth would be very, very, very demoralizing to them. They're doing their best. But after a point in time, whether it's the statistics are 100% valid or not, really doesn't matter. It's just that we have to make sure that we're doing the right things. But I agree with you. I mean, it's just a simple number we look at, but we look at a lot of other statistics that help validate that across the region. And that's really how we keep ourselves in check.
Great. Mr. Stone.
Thank you. I'm going to make a comment and then lob you a softball, so I'll make it nice and easy for you. But first, guys, thank you so much for coming. You look tired, but you looked energized with the graph coming down. So I see the spirit in you. So thank you for that. You know, I can't imagine, you know, the financial burdens that you faced, the safety, you know, questions you've had to, you know, put safety before empathy, so to speak. I appreciate that, and I appreciate all that you've done. I just want to share that, you know, my wife and I both had reasons to, you know, have outpatient procedures done, and I can tell you your teams are positive. They are, go back and tell your teams thank you, because they are spreading a positive word, and if it's wearing on them, you can't tell. So just a compliment to your entire teams. And then more importantly, my 83-year-old father-in-law just can't wait to get back and volunteer, and he let me know that he got his, he has his vaccine. So any idea what point in time he can get out of the house and come back and wheel people around the hospital?
That's not as easy of a softball question as you might think.
I know, it's probably a hard one.
I will tell you, I think we're closer to that than we've been. I think that, you know, we're hoping every week the COVID committee is talking about unwinding things we've had to wind up, tie up, or change to try to deal with this pandemic. And I know that that's on the agenda to periodically talk about. And when we can believe that we can get through enough tiers of age in our community with enough substantial vaccinations, I think that's going to happen hopefully sooner than we like to think. I think the worst is behind us.
Awesome. Thank you so much.
Certainly.
Great. Anyone else? Ms. Teener.
I just have a question. I mean, definitely this is not a hoax, and anybody says it is, they're wrong. But I guess my thing is I know quite a few people that have not gone to the emergency room, have not called the squad when they need to, because there are other illnesses besides this, and people are not being seen. I know people that have died because they had been diagnosed too late because doctors aren't seeing people. This phone thing and this tele thing is not medical care. And so what are you doing to encourage people, you know, if you're having chest pain, whatever, you need to come to the hospital, because people are afraid to come to the emergency room and it's too late. So are you guys getting that message out there?
We have been, and we've been talking about this. I'm actually part of the Ohio Hospital Association, as is Fairfield Medical Center, but we have weekly CEO calls, and that's been a constant theme, is that fear is causing people who need medical care to withhold their own care. And unfortunately, over this last year, we've seen many people show up at our doorstep too late. It's a very, very alarming trend. And it speaks to that drop in emergency room volumes we've seen, because people are more fearful of the thing that they don't have yet versus the thing that's killing them. And we have to encourage everyone in the community that you could come to the organization. It is safe. If you come to the emergency department, we've cordoned off an entire side of the ED for just COVID-positive patients, or COVID-suspected patients, I should say. And then the rest of it has been, you know, for general medical. But that is an ongoing concern, and that's nationwide. The national occurrence of severe illness to patients is rising precipitously because they're not seeking preventative or even emergent medical care when they need it. That's going to be one of these imperfect things that comes from dealing with life in a pandemic. The thing that I can't do is abate people's fears. You know, we've learned that every time you say that you're doing all the right things, you'll find someone who isn't, so I'm not going to say that. We learn from our mistakes, and I can tell you the gentleman standing behind me is really good about helping learn from things that don't go right. But we've learned how to do this well. I think that we're learning how to ensure the public that if they come to us, no matter what, COVID or non-COVID, that they will be kept safe and we'll keep them safe. And that's why we end up getting caught on both ends of our policies. You know, it's very imperfect. We sometimes have to, you know, I think someone mentioned that we have to err on the side of safety versus empathy. We've built an entire brand, and I believe a leadership philosophy on creating personal connection and being a good community provider and creating that unique experience for our community. And that's the one thing that's gone away this last year. You can't even see people's faces. So we've had to learn a lot, but I will tell you this, when it comes to emergent care, if anybody needs emergent care, please come. That's why we have multiple emergency rooms across town. Our numbers are starting to tick up a little bit. People are getting a little bit more comfortable, but I think that comfortability is going to come with resocialization as well. I can tell you very honestly, it's going to take, we've spent all our time with our heads focused on our people and the organization. It's been a while since we've been in a public forum like this, so Dave's probably looking at me like I gave you 15 minutes, like cut it off. But the bottom line is that I think the message I'll give to all of you is please ensure your loved ones, if they don't feel well, come get checked out. Please don't hesitate. Don't think that your chest pain is going to go away in a few days or a few weeks, because we've seen a lot of people whose families would have wished that they would have come. That's
And then a lot of people are dying, and it's not COVID, it's because of
Correct.
not being treated in time.
We could handle all of it, please.
Gentlemen, thank you for being here on such short notice, first of all, and more importantly, for all that you've done and all that your team is doing under difficult circumstances, performing at a high level as they have been. We're so grateful to you and to everyone who works with your organization, the care that you've provided to our community. And in addition to that, let me just also say thank you to how well you have communicated throughout this. I've had the opportunity to be in several different meetings where you've presented information, and it's always comprehensive and very, very helpful. So we really appreciate everything that you've done. Let's show them our appreciation for being here tonight.
And thank all of you for your continued support. It's tough to ask your community leaders to mute their own business needs and to try to not provide for your constituents. And I know why you're all here is because people in this community count on you. So thanks for backing us up when we needed it.
Absolutely.
Appreciate it.
Thank you.
Thank
Thank
you.
you, gentlemen. All right. Very good. Are there any petitions or memorials this evening?
There are none to be presented.
During this time at Lancaster City Council, we set time aside for the voters and taxpayers of Lancaster to address us on any item or issue that they would like. Before I go through my entire spiel, is there anyone who would like to address Lancaster City Council tonight between the two of you who are left? No? All right, well, thank you both for being here tonight. Reports of standing committees.
I have one Finance Committee meeting dated January 25th, 2021, submitted by Mrs. Downhour.
Mr. President, I'd like to make a motion to receive and file the reports of standing committees.
Second?
A motion and a second to receive and file reports of standing committees. All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries. Reports of special committees.
There are none to be presented.
We have no public hearings this evening, so we'll move to the reading of resolutions, beginning with the third reading of Temporary Resolution 2-21.
A resolution authorizing the Law Director's Office to apply for the Violence Against Women Act grant, offered by Mrs. Downhour, seconded by Mr. Stoughton.
Mrs. Downhour.
Yes, Mr. President, I'd like to make a motion that council pass, engross, and enter upon the written record, resolution temporary numbered 2-21.
Second.
We have a motion and a second to pass, engross, and enter upon the written record Temporary Resolution 2-21. Discussion, Ms. Downhour.
Yes, thank you. This resolution is so that the Law Director's Office can apply for the Violence Against Women's Act grant. It is an annual piece.
Very good. Further discussion on the motion to pass. Anything to add, Law Director Owen?
I would just, one thing is something that came to our knowledge, or attention again, I guess. We've been receiving this grant successfully for 23 years now.
That's unbelievable. Wow. Very good. All right, other questions or comments? Please call the roll.
Mrs. Bobbitt.
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener?
Yes.
Temporary Resolution 2-21 passes 9-0. Temporary Resolution 3-21.
A resolution authorizing the disposition of city property no longer needed via auction or internet auctions for 2021, offered by Mrs. Downhour, seconded by Mrs. Bobbitt.
Mrs. Downhour.
Yes, Mr. President, I'd like to make a motion that council pass, engross, and enter upon the written record resolution temporarily numbered 3-21.
Second?
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 3-21. Discussion, Ms. Downhour.
Yes, thank you. This is, again, our annual piece. It is to set up an auction to dispose of city property that is no longer needed.
Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener?
Yes.
Temporary Resolution 3-21 passes 9-0. Temporary Resolution 5-21.
A resolution authorizing the Service Safety Director to advertise for bids and enter into a contract for the purchase of salt for use by the Water Department, offered by Mr. James, seconded by Mr. Hall.
Mr. James.
Yes, Mr. President, at this time, I would like to make a motion that council pass, engross, and enter upon our written record temporary resolution 5-21.
Second.
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 5-21. Discussion, Mr. James.
Just briefly, this is some of the chemicals that they need for the water treatment process, and it's pretty much standard.
Very good. Further comments or questions on the motion to pass? Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener?
Yes.
Temporary Resolution 5-21 passes 9-0. Temporary Resolution 6-21.
A resolution authorizing the Service Safety Director to advertise for bids and enter into a contract for the purchase of phosphate for use by the Water Department, offered by Mr. James, seconded by Mrs. Teener.
Mr. James.
Yes, Mr. President, at this time, I would like to make a motion that council pass, engross, and enter upon our written record temporary resolution numbered 6-21.
Second.
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 6-21. Discussion, Mr. James.
This follows along with the same reasoning that I gave for the previous resolution. Once again, it's just the materials they need to complete the water treatment process.
Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener?
Yes.
Temporary Resolution 6-21 passes 9-0. Temporary Resolution 8-21.
A resolution authorizing the Service Safety Director to enter into an agreement with ODOT to purchase sodium chloride, rock salt, for the 2021-2022 winter season, offered by Mr. Schoonover, seconded by Mr. James.
Mr. Schoonover.
Mr. President, I'd like to make a motion that council pass, engross, and enter upon the written record temporary resolution 821.
Second.
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 8-21. Discussion, Mr. Schoonover.
Yeah, real quick, this is, I spoke to Mr. Hintz today, so 660 tons is what he's purchasing for next winter season at a savings. So we're looking at $68.47 a ton this year versus $83.95 last year. So the not too bad winter last year helped with the price this year. So you look at that as a plus for the street department.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener?
Yes.
Temporary Resolution 8-21 passes 9-0. Temporary Resolution 15-21.
A resolution to amend the certificate with the county auditor, appropriate from the unencumbered balance, increase receipts, and complete a fund transfer in the Water Fund 6003 and in the Water Utility Reserve Fund 6027, offered by Mr. James and seconded by Mrs. Teener.
Mr. James.
Mr. President, at this time, I would like to make a motion that council pass, engross, and add upon our written record temporary resolution numbered 15-21.
Second.
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 15-21. Discussion, Mr. James.
Just briefly, this is moving some money from the water fund into the water utility reserve fund to satisfy some of the covenants that we have to meet.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary resolution 15-21 passes 9-0. Temporary resolution 16-21.
A resolution to amend the certificate with the county auditor, appropriate from the unencumbered balance, increase receipts, and complete a fund transfer in the wastewater fund 6004 and in the wastewater utility reserve fund 6029. Offered by Mr. James, seconded by Mr. Hall.
Mr. James.
Mr. President, at this time, we'd like to make a motion that council pass, engross, and enter upon our written record temporary resolution numbered 16-21.
Second.
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 16-21. Discussion, Mr. James.
Just briefly, once again, this is just a transfer of funds to satisfy covenant requirements.
Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary resolution 16-21 passes 9-0. We now have second reading on temporary resolution 24-21.
A resolution to appropriate from the unencumbered balance and amend the certificate with the county auditor in the Community Development CHIP Home Program Funds 2083, offered by Mr. McDaniel and seconded by Mr. Stoughton.
Mr. McDaniel.
Second of 3 readings.
Second reading on temporary resolution 24-21. Temporary resolution 26-21.
A resolution to authorize a then and now certificate to pay an invoice for outside legal services in furtherance of economic development, offered by Mrs. Downhour, seconded by Mr. Stoughton.
Mrs. Downhour.
Yes, Mr. President, I'd like to make a motion that council suspend its rules and waive the third reading of resolution temporarily numbered 26-21.
Second?
We have a motion and a second to suspend the rules and waive the third reading of temporary resolution 26-21. Discussion, Ms. Downhour.
I'll save it.
Discussion on the motion to suspend. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Motion to suspend passes 9-0. Ms. Downhour.
Mr. President, I'd like to make a motion that council pass, engross, and enter upon the written record resolution temporarily numbered 26-21.
Second?
We have a motion and a second to pass, engross, and enter upon the written record temporary resolution 26-21. Discussion, Ms. Downhour.
Yes, thank you. This is so that we can enter then and now certificate for outside legal services.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary resolution 26-21 passes 9-0. We now have first reading on a series of resolutions, beginning with temporary resolution 27-21.
A resolution to authorize a then and now certificate to pay an invoice for outside legal services, offered by Mr. James and seconded by Mr. Hall.
Mr. James.
Yes, Mr. President, this time I would like to make a motion that council suspend its rules and waive the second and third reading of temporary resolution 27-21.
Second.
We have a motion and a second to suspend the rules and waive the second and third reading of temporary resolution 27-21. Discussion, Mr. James.
I'll save it.
Discussion on the motion to suspend. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Motion to suspend carries 9-0. Mr. James.
Mr. President, this time I would like to make a motion that council pass, engross, and enter upon our written record temporary resolution numbered 27-21.
Second.
We have a motion to pass, engross, and enter upon the written record temporary resolution 27-21. Discussion, Mr. James.
Briefly, as Denise Cruz mentioned, there was some additional fees from the legal review for some of the easements that they had carrying over from the end of last year.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary Resolution 27-21 passes 9-0. Temporary Resolution 28-21.
A resolution authorizing the Service Safety Director to enter into an engineering agreement for the construction administration of the South Water Plant Concentrate Line Rehabilitation Project and authorize a then and now certificate offered by Mr. James, seconded by Mrs. Teener.
Mr. James.
Yes, this is the first of two readings.
First of two readings on Temporary Resolution 28-21. Temporary Resolution 29-21.
A resolution to authorize the Service Safety Director to enter into an engineering agreement for the U.S. EPA Required Risk and Resilience Assessment offered by Mr. James, seconded by Mr. Hall.
Mr. James.
Mr. President, at this time, I would like to make a motion that council suspend its rules and waive the second and third readings of temporary resolution numbered 29-21.
Second?
We have a motion and a second to suspend the rules and waive the second and third reading of Temporary Resolution 29-21. Discussion, Mr. James?
I'll save it. Thank you.
Discussion on the motion to suspend. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Motion to suspend carries 9-0. Mr. James.
Yes, Mr. President, thank you. I would like to make a motion now that council pass, engross, and enter upon our written record temporary resolution numbered 29-21.
Second?
A motion and a second to pass, engross, and enter upon the written record Temporary Resolution 29-21. Discussion, Mr. James.
Just briefly, as Superintendent Nixon mentioned in our Finance Committee meeting, there's not a lot of time to put this major report to meet some new requirements from the EPA. So getting it started as quickly as we can is why we're suspending and approving.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary Resolution 29-21 passes 9-0. Temporary Resolution 30-21.
A resolution to appropriate from the unencumbered balance and amend the certificate with the county auditor in the sanitation fund 6005, offered by Mrs. Teener, seconded by Mr. Matlin.
Mrs. Teener.
Mr. President, I would like to make a motion that council suspend its rules and waive the second and third reading of Temporary Resolution 3021.
Second.
We have a motion and a second to suspend the rules and waive the second and third reading of Temporary Resolution 30-21. Discussion, Ms. Teener?
I'll wait.
Discussion on the motion to suspend. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Motion to suspend carries 9-0. Ms. Teener.
Mr. President, I would like to make a motion that council pass and gross and enter upon the written record Temporary Resolution 30-21.
Second.
We have a motion and a second to pass and gross and enter upon the written record Temporary Resolution 30-21. Discussion, Ms. Teener.
Yes, Bill Burrows from our Lancaster Sanitation Department, department head, is unexpectedly retiring. Nothing's wrong, he's just been in it for 44 years and he's done, I guess. So, that's the best way I can explain it. So there's a small amount that needs to be transferred over that, it was like $3,000, which actually is a pretty minimal amount from what we have had to do in other departments sometimes for retirement. So that's all it is.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary Resolution 30-21 passes 9-0. Are there any further resolutions to come before Lancaster City Council this evening? If not, we'll move to the reading of ordinances, beginning with the second reading of Temporary Ordinance 3-21.
An ordinance to accept the final plat for Timber Top Phase 1, offered by Mr. Matlin, seconded by Mr. Hall.
Mr. Mallon.
Mr. President, I'd like to make a motion that council suspend its rules and waive the third reading of temporary ordinance 321.
Second?
We have a motion and a second to suspend the rules and waive the third reading of Temporary Ordinance 3-21. Discussion, Mr. Mallon?
I'll save it.
Discussion on the motion to suspend. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Motion to suspend carries 9-0. Mr. Mallon.
Mr. President, I'd like to make a motion that council pass and gross and enter upon the written record temporary ordinance 3-21.
Mr. Hall.
Oh, I'm sorry, second.
That's okay, thank you. We have a motion and a second to pass, engross, and enter upon the written record temporary ordinance 3-21. Mr. Mallon.
Yes, this is an ordinance to accept the final plot for Phase 1 of the Timber Top project. It establishes the start of the roadways, the drainage easements, where all the underground is going to be, and it allows the contractor to get started as soon as the weather breaks to get Timber Top going.
Very good. Further discussion on the motion to pass. Please call the roll.
Mrs. Bobbitt?
Yes.
Mrs. Downhour?
Yes.
Mr. Hall?
Yes.
Mr. James?
Yes.
Mr. Matlin?
Yes.
Mr. McDaniel?
Yes.
Mr. Schoonover?
Yes.
Mr. Stoughton?
Yes.
And Mrs. Teener.
Yes.
Temporary ordinance 3-21 passes 9-0. We now have first reading on a series of ordinances, beginning with first reading of temporary ordinance 4-21.
An ordinance to repeal and replace Lancaster Codified Ordinance Part 11, Planning and Zoning Code, Title 3, Zoning and Property Restrictions, Chapter 1123, General Provisions, Chapter 1129, Residential Districts, Chapter 1133, Commercial Districts, Chapter 1151, Off-Street Parking and Off-Street Loading, and Chapter 1161, Definitions of the Codified Ordinances of the City of Lancaster, offered by Mr. Matlin and seconded by Mr. Schoonover.
Mr. Matlin.
First of three.
First of three readings on temporary ordinance 4-21. I'll note we have a public hearing set on this ordinance for February 22nd at 6:30 p.m. Temporary ordinance 5-21.
An ordinance to repeal and replace Lancaster Codified Ordinance Part 11, Planning and Zoning Code, Title 3, Zoning and Property Restrictions, Chapter 1135, Industrial Districts, Chapter 1151, Off-Street Parking and Off-Street Loading, and Chapter 1161, Definitions of the Codified Ordinances of the City of Lancaster, offered by Mr. Matlin and seconded by Mr. Hall.
Mr. Matlin.
First of three.
First of three readings on temporary ordinance 5-21. I'll note again, we have a public hearing set for this ordinance on March 8th at 6:30 p.m. Temporary ordinance 6-21.
An ordinance to repeal Lancaster Codified Ordinance Part 1, Administrative Code, Title 5, Chapter 133, Fire Department, Section 133.08, Pickup of Contributions to Disability and Pension Fund, and to declare an emergency, offered by Mrs. Downhour, seconded by Mr. Stoughton.
Mrs. Downhour.
First of two readings, please.
First of two readings on temporary ordinance 6-21. Temporary ordinance 7-21.
An ordinance to repeal Lancaster Codified Ordinance Part 1, Administrative Code, Title 5, Chapter 131, Police Department, Section 131.01, Fee for Copies of Records, Section 131.02, Gasoline Allowance for Police Chief, and Section 131.03, Pickup of Contribution to Disability and Pension Fund, and to declare an emergency, offered by Mrs. Downhour and seconded by Mrs. Bobbitt.
Mrs. Downhour.
First of two readings, please.
First of two readings on temporary ordinance 7-21. Are there further ordinances to come before Lancaster City Council this evening? If not, we'll move on to unfinished business. Does anyone have any unfinished business tonight? Mr. Stoughton.
Mr. President, I'd like to thank you for inviting Jack and Mark tonight. That was a very good update, and it's nice to see the positive coming from them as we hopefully get on the far side of this. So thank you for inviting them.
Well, thank you, and thank you again to them. I know they're not here right now, but I appreciate that coming out again on short notice, and thanks to each of you for your engagement. I thought you had good questions, and it was positive information as we continue to move through this. So thank you, Mr. Stoughton. Further unfinished business this evening. I'll just note quickly that the Salary Review Committee has met, and I can't say thank you enough to Human Resources Coordinator Gretchen Nyheiser for her work in compiling all the data that we need to go about this work. The committee has now the documents and information they need to review some, I think, 54 or 56 positions, non-union, non-management to begin with, and it's my hope that in the next several weeks we'll have a report and recommendation to council from that. We are meeting again at, I think, the first week of March is when everyone is to have their recommendations to come back to the larger committee. That committee will meet and then will move their recommendations forward to this council for action or not, whatever it is you may choose. So the process is moving forward. Again, I'm thankful to the members of that committee who have so willingly given of their time to serve. It is not an easy or non-time intensive thing. It's going to take some time to get this done, but I'm thankful for all that are involved. Other unfinished business this evening? If not, we'll move to new business. Does anyone have any new business tonight? Ms. Downhour.
Yes, thank you, President Uhl. I just wanted to let everybody know that at the next meeting, I will be bringing in my formal resignation. My house has sold, and my husband and I will be moving out of the city limits as of the end of April. So April 26th will be my last official city council meeting.
We won't have to accept it, though, do we?
I think
We could table it.
if she's moving out of the city, that might.
Moving out of the city, so.
Well, Ms. Downhour, let me just say first, thank you for your willingness to serve. You have come in and ably over the last, period of time taken on the Finance Committee, which is a significantly important committee, and for the work that you've done on City Council. We appreciate you and your service to the city of Lancaster. So thank you very much. Just to update everyone very quickly on the process, Ms. Downhour did make myself and chairman of the Republican Party aware of her resignation this past week. The Lancaster members of the Central Committee will get together to appoint a replacement not 5 days sooner and not later than 45 days after her resignation becomes effective. And so it will be into May before we're able to meet and make that happen. So stay tuned to that, or for that. And again, thank you, Ms. Downhour, for your service. We appreciate it. Not the last we'll see of you, I hope.
No.
Excellent. Very good. Anyone else have new business this evening? The mayor has new business tonight. Mr. Mayor, would you update us on plans for the state of the city, please?
Yes, the state of the city will be all virtual this year. This probably comes as no surprise to anybody. The taping for that will be held tomorrow. We'll be visiting a number of departments to kind of give an inside look at some of the things you never get to see, or the public never gets to see, in running our departments. So hopefully it'll be interesting, informative, and maybe even fun.
That's great. And what's the date for that?
February 25th it will be released.
February 25th. And will it show, is it like a particular time, or is it just going out whenever?
No, I think it's just going to be released, and you can watch it at your leisure.
Very good.
Get a beverage and a popcorn and watch away.
Is that good, huh?
We'll find
Don't
out.
know.
Yeah, don't know yet.
It's not in the can yet.
All right, we'll find out. Very
If I
good.
throw
Thank you.
popcorn
Thank
at
you,
you,
Mayor.
I'll have to clean it up, though.
Excellent. So I don't have to get up at 7 a.m. and get over to Olivedale I'm going to miss the bacon, though. I like the bacon at the Olivedale, so. All right, I'll have to deal with that, I guess. Okay.
And you won't have to pay for it.
That's true. Don't have to pay for it. Ms. Tina, I saw your hand.
No.
No, you didn't see your hand?
No.
Okay.
Well, you might have, I don't know.
But you don't remember?
It's probably waving at you from over
Very
here.
good.
I don't know really.
All right, Mr. Schoonover, I'll just note that you had an article in the paper here, and involves us in the city, the budget we passed, and the money allocated to work through our trap, neuter, and release policy, and that's a positive thing. If you want to provide any information or talk about when you think that might gear up.
We are working through some of the final details. I think the big thing to get across that maybe the article didn't touch on is really the goal when we start this is to get to the trouble houses in every neighborhood. I think every neighborhood has one. So, I read the comments and everything got shared on Facebook. So it was kind of one of those where, okay, we've actually started a log. Like we're already getting reports of, hey, start in this neighborhood or start on this street or go knock on this person's door. And really the idea is to target the folks that are feeding 20 or 30 at a time. So the people that feed 1 or 2 at a time, we'll get to you eventually. But really we want to make the biggest impact as quickly as possible with that program. So I'm actually doing some onboarding of some new employees. We have our veterinarian, our Tuesday veterinarian is coming on full-time next week. So I hope to really be starting to perform surgeries and getting with people hopefully the first part of March.
Great.
Yeah.
Yeah, I saw a number of suggestions of places you might go and check out on Facebook, and so
yeah.
And just to be clear, when we talk about trap neuter release, we have to release back in the city.
Yeah.
Okay. I was just checking.
They're gonna come back. They're gonna come back to the same place. I
As
do.
far as you know.
Yeah, right.
I'm not gonna be doing the illegal dumping, so
Okay.
you know what I mean.
All right.
But it'll work out. I think there's always some skeptics with that kind of program. But we've done it before. We saw good results with it, so I think we should all be encouraged. And I don't know about the rest of you, but I'm sure every one of you has had a stray cat complaint. Unfortunately, it's not going to make them all go away, but it really does solve a lot of problems. So they're still going to have to find a place to go to the bathroom, let's be clear. So it is what it is.
But over time,
Absolutely.
Yeah, over time, the goal is that we're going to start to see, I mean, the same number of cats likely will exist even as this program goes on or starts, but eventually we're going to see fewer and fewer stray cats over time.
Yeah, absolutely.
As a result of this. Good. Anyone else have new business this evening? Mr. Mayor.
Along the same topic, I might add that we've received many complaints over the years, even here at City Council, from neighbors of cat residences, let's just call it, and we have never been able to address that. And this is a small program. We started out, we budgeted $15,000 for 2021 and hope to be able to take care of 600 cats, but unless we had passed the income tax increase last November, this would not have happened. So this is one small example of how the city will be improved as a result of having some more money to spend for such programs.
Yes, I remember when the resident came and had concerns multiple times, and I think there was a recognition of those concerns, but an inability to address them at that time. And so hopefully this will impact that as we continue forward. So, all right, very good. Any other new business on this or any other topic this evening? All right, then we'll ask that the clerk read our upcoming scheduled meetings.
Our next regular scheduled meeting is February 22nd at 6:30 PM here in Council Chambers. At that meeting, we will have a public hearing on temporary ordinance 4-21. The following meeting will be March 8th at 6:30 PM. At that meeting, we will have a public hearing on temporary ordinance 5-21. Upcoming committee meetings for the next 30 days. Water Pollution Control, February 10th at 8 AM, City Hall 1897 Conference Room. Public Works, February 12th at 7:30 AM at the City Hall 1897 Conference Room. Finance Committee, February 22nd here in Council Chambers at 6 PM. Code Enforcement, March 1st at 8 AM, City Hall 1897 Conference Room. Safety, March 5th at 7:30 AM at the City Hall 1897 Conference Room. And finally, Finance, March 8th at 6 PM here in Council Chambers.
Very good, thank you. Are there any bills this evening?
There are none to be presented.
Is there a need for an executive session? If not, a motion to adjourn is in order.
Mr. President, I would like to make that motion to adjourn.
Second.
We have a motion and a second to adjourn the meeting. All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries. Our meeting is adjourned. Thank you all very much. Please remember to sign your legislation. Have a great week.